What would be the most likely cause of back pain in a 48-year-old patient with bilateral leg pain and weakness, urinary retention, decreased rectal tone, and saddle anesthesia? A. Abdominal aortic aneurysm. B. Bone metastasis. C. Epidural abscess. D. Herniated disc. E. Primary bone tumor. Answer is D. Herniated disc. The listed symptoms and signs describe cauda equina syndrome, which is usually caused by a large central herniated disc. Other less common causes include tumor and infection. What percentage of herniated discs regress or completely resolve over 6 months? A. 5%. B. 33%. C. 50%. D. 66%. E. 90%. Answer is D. D. 66%. Serial magnetic resonance imaging studies have shown that 66% of herniated discs regress or resolve over 6 months. This high percentage argues for early conservative therapy and argues against early MRI or computed tomography imaging. Disc herniation with involvement of the L5 nerve root will present with which of the following findings? A. Decreased or absent ankle jerk. B. Decreased patellar reflex. C. Diminished sensation of the lateral small toe. D. Impaired plantar flexion. E. Weakness with extension of the great toe. Answer is E. Weakness with extension of the great toe. Involvement of the L5 nerve root presents with weakness, with extension of the great toe, decreased sensation in the first web space, and normal reflexes. An S1 radiculopathy is characterized by diminished sensation of the lateral small toe, impaired plantar flexion, and decreased or absent ankle jerk. The patellar reflex is associated with L2-4. A history of intravenous drug use increases the risk for which of the following causes of acute back pain? A. Abdominal aortic aneurysm. B. Epidural hematoma. C. Malignancy. D. Transverse myelitis. E. Vertebral osteomyelitis. Answer is E. Vertebral osteomyelitis. Vertebral osteomyelitis and spinal epidural abscess are diagnosed most frequently in an at-risk population that includes patients with a history of diabetes, chronic renal failure, intravenous drug use, alcoholism, cancer, and recent surgery or trauma. Plain films have the highest utility in diagnosing which of the following? A. Abdominal aortic aneurysm. B. Epidural hematoma. C. Spinal stenosis. D. Transverse myelitis. E. Vertebral osteomyelitis. Answer is E. Vertebral osteomyelitis. Plain films are diagnostic in 80% to 95% of cases of vertebral osteomyelitis. There is limited usefulness with any of the other conditions listed. Spinal epidural abscess is most commonly caused by which of the following pathogens? A. Mycobacterium tuberculosis. B. Pseudomonas aeruginosa. C. Staphylococcus aureus. D. Staphylococcus epidermidis. E. Streptococcus pyogenes. Answer is C. Staphylococcus aureus. Staphylococcus aureus causes 70% of spinal epidural abscesses.